You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of hair restoration procedure. With us, we have the medical director for Bosley, and they are the worldwide leader in hair restoration. With us, we have Dr. Washenik. Dr. Washenik, welcome to the program.
Thank you so much, Randy. Thank you for having me.
Now, I know you brought a lot of photos. We'll try to get to as many of those as possible. But who's a typical patient that's coming in today for the hair restoration?
Yeah, so it's never good when I can't answer your first question.
All right.
So we don't have a typical patient, right? We have people from all walks of life, different ages, younger people, people who are into retirement age, that feel they're losing hair, they're unhappy with it, it's affected them in some way, and they want to take control of that. So they come to see us to see what can be done.
And now you're a customer.
I am. I'm a patient.
I was looking at your hair.
Yeah,
I mean, it doesn't look like
patient.
you had anything done.
And that's pretty much where you want to be when you have some hair restoration, is you want to look like yourself with more hair. You want to look like something better happened to your hair. Folks will use terms like, natural. I like to say it's just normal looking head of hair.
Now, hair restoration, hair transplant surgery has become mainstream. I mean, now it is acceptable.
Very much
so. Is that right?
Yeah, very much so. When you see a list of commonly done cosmetic surgery procedures, hair is very high up in that list now. It's something that over time people have realized gives them the result they want. It works. They could look the way they want to work, they want to look, and so more and more people are availing themselves to it.
So we're going to take a quick break. We come back, I want to hear more about the process and take a look at some of those photos.
Okay.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
The results I've achieved from Bosley have been exceptional. This is my real hair. It's permanent. You cut it, it grows. I can do with it whatever I want. It's just mine.
I can comb, cut, wash, style, do whatever I want with it.
With Bosley, I got my hair back. I got my confidence back. There's not a day that goes by that I don't look in the mirror and say, that's the best money I've ever spent.
Bosley works for 3 reasons: prevention, retention, and restoration. And here's the proof that that strategy is fantastic.
We want to prevent further hair loss, we want to retain the existing hair that you currently have, and we want to restore the hair that you've already lost. So if we can put those 3 things together, it's going to give you the result that you're looking to achieve.
I would wear a hat. I would try to cut my hair differently.
When I was in college, I would notice more hair in the drain. I didn't want to believe that I was losing hair.
By the time I went to Bosley, this entire area here, it was gone. I look back and I didn't realize how much it affected me. I can't imagine now life without hair.
We combine all the medical development, the scientific development, and translate that into an artistic outcome. You want it to be artistically wonderful. You want it to look like a great head of hair, and that's what we pride ourselves in at Bosley.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, we're with the leader in hair restoration. We're here with the Bosley folks, and we're here with the medical director, Dr. Washenik. Dr. Washenik, welcome back to the program.
Thank you.
So
Thanks.
these photos that you're showing me, this is kind of what you see every day.
Yeah, yes, these are fine examples of folks who've had a change, in their opinion, for the worse in their hairline, a thinning, loss of their hairline, and they were able to replace that, reconstruct it.
Okay, let me take a look at that one.
All right, so here's a young man here who was just dismayed by the way his hair had begun to look over the past few years. And when you look at the photos, they're dry, they're before and after photos, but you could see sometimes, and I think his is a good example.
Is he too far gone, somebody this bald?
He absolutely was not. But that's a great point, because I think what people need to do is go in and see someone a physician who knows what can be done, because too many people self-diagnose and say there's nothing that can be done.
It's too far gone.
I waited too long. Medicine doesn't have a way to help your hair, right? That's something we've been looking for, throughout history. How can we help my hair? But we can help your hair. And the last thing you want to do is just consign yourself to not being a candidate until you go in and speak to an expert who can help you understand what can be done. So take a look at his after photo.
Wow.
All right, so this looks like a very different man.
Yeah.
And again, you know, it's a different photograph, and of course he can look different, but his eyes look, you know, different. I mean, he looks, as he communicates, that he just feels so much
He looks
better
handsome.
about
Looks
himself.
more handsome, actually.
Well, that was a term he
And
actually
younger. He looks a
used.
little younger.
Yeah, those were terms he used, and he would not be the only one. You hear that over and over, and you hear that from family members. You hear that from spouses who come in and say, I just can't get over what a difference hair makes. I wouldn't have predicted that change in hair would have made that big a difference, and now they're thrilled. The majority of our patients do not have hair transplantation surgery. Our medical approaches are wonderful at slowing down, stopping, and even reversing the hair loss that a lot of patients have experienced.
So for the non-surgical, you've developed this Trigen.
Yes.
That you have at Bosley.
Yes.
What is that?
So Trigen is a nice combination of a medical approach, a physical approach with low-level laser stimulation of hair growth, and then the use of PRP, platelet-rich plasma. And we find the combination is much more potent than any of the individual components. So the sum far exceeds the individuals.
Good. You know, most people know Bosley, right? We've seen your advertisements, things like that. Knowing you're going to be on this interview show where people get a chance to actually meet you, especially the medical director, what do you want people to know about Bosley?
You know, I think that the thing I would like to know about Bosley is we're there for you, right? We care about two things a lot, our patients and their hair. And we're available around the country. We're easy to find. We have a ton of experience, and we really know this field and can help you.
So at all of the centers, I mean, if you're going to get a restoration procedure done, they always work with a medical doctor.
Yes.
It's designed by the medical doctor?
It's designed by the medical doctor. There's no other way to do this. The nuances of this process, first of all, it's medical, it's surgical, you have to see a doctor, and our doctors know how to do this. They will work with you to get a design that you're happy with.
You know, and I've told you when we talked on the telephone that I feel like I could spot a hair transplant, 10 yards away. That it's obvious.
Yep, you did. And that's a big part of where experience matters.
Okay.
Is not having it be obvious. You know, my hairline is restored, and whether you think it's perfect or imperfect,
it looks good. It looks good.
No one thinks I've had hair restoration. No one slows down and looks at my hair for any other reason than they would look at anyone else's hair.
Now we have a photo of you, by the way, if you don't mind showing.
I don't
we'll go to
mind
that
at all.
photo. Were you insecure about your hairline back then?
So I was not insecure about my hairline, but I knew very much what could be done and that there was no reason not to optimize it. And that's the beauty of what we can do right now with medications and with surgery. So the Trigen Plus approach, the medical approach, the surgical approach, there is not a reason to have hair that you're less than thrilled with.
Now, you have more photos. What are we looking at here?
So, we see, patient after patient who comes in who is losing their hairline, is losing that frontal forelock, the thing you look at. When you speak to someone, whether you look for it or not, you assume their face is framed with hair. And when it's not, it changes their appearance. And most folks, whether...
It's just like one after another. I mean, you have hundreds of these.
Well, we actually have hundreds of thousands of these.
Oh, is that right?
Yeah,
okay.
we do. And so some people will keep their hairline, but it'll thin out, and it'll be so see-through that they feel like they lost their hairline. Well, hopefully what you're noticing in these photos is people are not restricted to a hairstyle, right? Everyone doesn't have to comb their hair like I do because they've had hair restoration surgery. People who come in and work with us just go back to doing what they always wanted to do with their hair. And they can, part it in the middle, they can part it on the side, they can comb it forward, they can comb it backward. Those things are not dictated at, because this is very natural, normal looking hair when you restore it.
When men come in and they want to do the procedure, do they feel like that more hair is going to make them look younger? Do they think that more hair is going to make them more attractive? I mean, on the consults, what are the physicians you work with? What do they say?
Yeah. So all of those things.
Okay.
All right. So more hair or redistributed hair will make me look younger, will make me look healthier, will make me look more vital, will make me look more presentable when I'm looking for a job, when I'm out on a date, will make me not have to think about my hair and let me be myself.
Okay, we're gonna take a quick break. We come back, more about the process and more photos. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I wanted to react soon before I didn't have to deal with anything very major, like losing a ton of hair. And romantically, yeah, I mean, I could look people in the eye now, and I know they're not like staring at the top of my head.
When you look at the before pictures and you look at me now, it's like a different person. I even have a different personality. I've been bodybuilding for 16 years. I've only competed in the last year. Without this Bosley procedure, I wouldn't be able to do it, period. Now, I don't even think about the fact that I used to have a problem with hair loss because it's been corrected.
Hey everybody, I'm Dean Banowitz, Hollywood hair guy, celebrity stylist. Everybody asks how they can look younger. And when you have a fuller, thicker head of hair, you're gonna look a lot younger. Well, people always think I do have the most amazing hair. They don't realize that I actually have had a Bosley restoration. Since I've had my restoration done, I've probably sent close to 50 people to Bosley. Not only because it's amazing and it works, but they guarantee it. And the key is it's prevention, retention, and restoration. Now, I have a full head of hair, beautiful, shiny hair that I can color, I can cut, and I can style it any way. I can do all of that, whatever I want, because now I have hair.
When I first started noticing I was losing my hair, I was about 28. One of the first triathlons I ever did. All I was thinking about was pulling off my swim cap and how bad my hair was gonna look. I look back and I didn't realize how much it affected me until after I got it done. If I have any regrets, it's that I didn't call Bosley sooner.
For me, it was more, I call it a preemptive strike. Let me get in there and do something now before it gets worse. Hair loss is progressive. If you do nothing about it, you know, it's just going away. So with the help of Bosley, it enabled me to retain the hair that I had and restore the hair that I left. So I was ahead of it.
I spent 18 years trying to fight my hair loss, but it was on a daily basis that I could look at a towel or look at a pillow and say, you're losing this battle. Bosley gave me my hair back. I cut this hair, I wash this hair. I mess this hair up if I want to mess this hair up.
We combine all the medical development, the scientific development, and translate that into an artistic outcome. You want it to be artistically wonderful. You want it to look like a great head of hair. And that's what we pride ourselves in at Bosley.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of hair restoration. With us, we're here with the leader in hair restoration, Bosley, with their medical director, Ken Washenik. Dr. Washenik, welcome back to the program.
Thank you, Randy.
So you've had the procedure yourself.
I have.
And you say you see transformations every single day in your centers across the country.
We do. Our practices are full of people who are changing their lives by restoring their hair. And one of the things that I hoped to point out to you is the effect that other approaches beyond surgery can have on people. So, you know, we talked earlier and discussed medical approaches, right? Something called Trigen Plus, a multifaceted way to get after your hair loss. We talked about the things I've done so that my surgery done well over a decade ago remains intact.
So you don't get any thinner?
Any thinner,
okay.
right. Because I still have male pattern hair loss. When someone comes in, they still have those genes. We haven't changed that on me, but what we've done is addressed it. So I mean, I have a few examples here of folks who've not had surgery, but who've done, you know, very, very nicely with medical approaches. And importantly, ladies, women with hair loss, right? So we talk about the devastating effect of thinning hair loss on men. With women, hair loss is tragic, right? There are no role models for women with hair loss. You know, we all, as men, we all have somebody we can point to who is a movie star or an athlete with hair loss. It's less so for women, and that's very difficult. Luckily now, we have things we can do medically for women.
So more and more women are coming in?
Yes, yes. And I think part of that is because if you look here, here's an example of someone who did medical treatments, and you could see the change. And in the thickening of their hair. And that's what you're after. See, when we do hair restoration, I showed you a lot of photos of hairline reconstructions like mine. We have medical approaches. We have Trigen Plus. We have the combination of the medications, the lasers, and the PRP that can help people who don't even end up needing surgery.
So back to this person right here. This is purely non-surgical? I mean, they go to Bosley.
Correct.
So Bosley isn't just about surgery.
Is not. Yeah, we approach hair loss from all of the available angles that we can.
And you have all the new stuff, right? I mean, you even have the newest robot.
We do.
Is that right?
We do. Yeah,
So whatever it takes to give them the best hairline, is that kind of how you're approaching it?
Yeah, you know, I said it earlier, we're obsessed about hair. So it's not like we're reading about other things. It's not like things are coming out and we're missing them. So we're on top of that, and we vet them. It's a fancy word for that. We do our due diligence. We want to make sure we have the latest and the best when it makes sense for
Okay,
you.
we're going to take a quick break. We come back. More about the process and more photos. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Hair restoration is no longer a myth. It's a scientific fact. After decades of extensive research, there are now new, highly effective non-surgical restoration techniques. Bosley introduces Trigen with Power Matrix PRP, a scientific advancement in hair loss.
It felt very good hearing from my wife or from my coworkers, hey, that stuff's working.
Having my hair back means so much to me. I'm happy when I look in the mirror.
Trigen with Power Matrix PRP is a simple, powerful treatment that helps you preserve the hair you have, stimulate new hair growth, and promote stronger, healthier hair. It uses a breakthrough technique in hair restoration called Platelet-Rich Plasma, or PRP. We collect a small amount of your blood and enrich the plasma. We extract the platelet-rich plasma and inject it into your areas of hair loss. The platelet-enriched plasma promotes the biostimulation of your scalp, helping to both regrow your hair and thicken existing hair. Bosley's unique Power Matrix PRP process strategically creates a matrix in the scalp, allowing the nutrients to synergistically work together to restore your hair. We'll choose the right Bosley professional strength products for you. Their ingredients will nourish and invigorate your scalp and hair to prevent further hair loss and promote regrowth, all while leaving your hair looking fuller, richer, and healthier. Finally, we'll give you one of our clinical strength low-level laser therapy devices. This will provide a specific wavelength of light for your scalp, stimulating tissue molecules. With just a few brief sessions per week, you can regrow and strengthen your hair from the privacy of your own home.
I would absolutely say go do this. Go do PRP, especially with Bosley. Not only did I feel comfortable, I loved what the whole process looked like. I loved how they took care of me, and I'm just thrilled.
It was very quick as far as the procedure. I was in and out in 15, 20 minutes. Came home, went to work the next day. My wife started noticing and I started noticing real hair growth. This stuff actually works. I'm absolutely a Bosley believer.
At Bosley, we know exactly why you're losing your hair, and we know how to naturally regrow it.
The science is proven, and Bosley is the world's most experienced hair restoration expert. Get your hair back. We can help.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, we're with a leader in hair restoration. We're here with the Bosley folks, and we're here with the medical director, Dr. Washenik. Okay, what are we looking at right there? We have time for like one or two more.
So, you know, these are folks who have had some thinning that have been helped by filling in the thinning. We have folks who...
this is a lot of thin hair.
It's a lot of thinning and a very dramatic recovery from that. Here's a fella who just had no frontal hairline and had gone into a recession to the point of maybe it's too much of a medical term, but a concave, like a look as opposed to a pointed look. His face was not framed with hair, and framing a person's face with hair makes a giant difference to the way they feel about themselves.
Back to this guy, are there guys, so guys like this, I think you said it earlier, but guys like this think they're too far gone. Like, I'm too bald to get this done. So this guy has no hair in the middle, it looks like.
So unfortunately, a lot of people do, and that's the nice thing about phoning and getting our information package. So you can see examples of people who maybe you thought were too far gone and got a very nice result, and then you can do the same thing.
Now, obviously, you're the medical director of Bosley.
I am.
And you have more experience than anyone. If somebody's going to do this, should they at least consult, get a second opinion? Like, everybody should visit Bosley at least once? Is that your feeling? I mean, if you're going to do the procedure, you might as well go to the most experienced. Is that your feeling?
Well, I feel strongly that knowledge is power. Get out, get opinions. Find out what can be done and make sure there's consistency and you're hearing a story that makes sense for you and gives you confidence. So yeah, I think I would recommend that.
When we were talking on the telephone, you were talking about even the angle of the follicle. In fact, you said we are meticulous about the follicle. What does that mean?
Well, you have to be. You have to be. When you look at someone's hair, you only need one hair going the wrong way, and it's noticeable. We are meticulous in our reconstruction.
Like even the way you tilt the hair?
The angle, the direction, the tilt, whether it's one hair follicle or two hairs or three hairs coming out of an individual, grouping, that's very important where you put that. So, we use techniques that we refer to, and it's kind of jargon, differential density, variografting. Right. But
that means the hairs in the front are going to be positioned different than the ones in the back.
And they're gonna be thinner, right? What do you want? You want a forest, not an orchard.
Okay.
Right? And so this has to look like a naturally found event. And that's what we are obsessed with.
Is that what experience does for you?
It does.
Knowing how to position the hairs right?
It does.
Because I know you're not allowed to say you're the best on the show. We already know that, right?
Well, yes, absolutely not. And you're going to put the hair in, they're going to grow. But you have to do it in a way that artistically looks the way your hair is supposed to look. And we're great at that.
And Bosley has won awards. I guess there's industry awards. It seems like you've won all of them.
There are.
Is that right?
We are very, very honored to have in our group people who have won, doctors who have won awards, and you might laugh, but we actually call them follicle awards in our field. And so we have people who've won golden follicles and platinum follicles, and assistance awards for the Distinguished Assistant Award. So all the way across, our group is very well represented in the field and honored.
So your recommendations start with this information packet.
Get the information packet. Empower yourself with some knowledge, then make the phone call, come in, have a consultation, and connect those dots, what you read about in the package and what the physician feels is right for you.
And it doesn't have to be noticeable. Because I feel like I told you, I feel like I could spot it.
Yeah.
So if it's done right, you don't spot it.
That's an old thought, reputation. And again, my hair is just one example, but regardless of whether you're thinking I'm combing my hair correctly or not, no one knows I had hair restoration
Well, you told me on the
surgery.
phone, you said you won't be able to tell mine is done, and I'm thinking, I bet I will.
Yeah.
And no, you can't tell. There's no doubt about it.
Yeah, and I'm not an outlier. This is the way, when done correctly, and I take great pride in the work we do at Bosley, this looks like an absolutely normal head of hair.
Okay, good. And you're always staying on top of, so it's fair to say you have all the newest stuff, PRP, lasers. I mean, you're doing everything you can to hold on to that hair.
Yes.
So no matter where they go at Bosley, this is what they're getting.
No matter where they go at Bosley, we're Bosley. And one of the things I take very great pride in is the consistency we have across the country. We are all the same practice. We're not different practices. And that's how we employ technology. That's how we employ medications. That's how we do surgery, is with a common core.
Now you do this hair by hair Bosley FUE. What is that?
We do. So that's just an example of modern technology. So a newer way to do hair transplantation is to remove follicle by follicle, follicular unit extraction, or FUE. And yeah, we certainly do that, and it's very popular with our patients.
So nowadays, if you don't want it, you don't have to have that strip scar in the back of your head. Is that true?
You do not have to have a strip harvesting. You can do individual harvesting. Yes, absolutely true.
The main reason that a Bosley restoration works is because we're taking hair from the back of the head, hair that is resistant to DHT, hair that is permanent, and we're moving it to the front of the head where it's going to continue to grow for the rest of the patient's life. You can do whatever you want with it. If you want to make a mohawk, you can make a mohawk. If you want to color it, you can color it. You can cut it, do whatever you want to do. It is your own real hair.
When you come in for your free Bosley consultation, you'll meet with a physician just like myself. We'll go over your medical history, we'll examine your scalp, we'll do a microscopic scalp analysis to get at the root of what's going on, what's behind your hair loss.
And then we're going to design a custom treatment plan. So when you walk out of our office, you're going to know how to take back control of your hair loss problems and what our restoration process can do
to really help give you that fuller, thicker head of hair.
I thought, you know, my hair is gone. I'm never going to be able to run my fingers through my hair again. But now I put it through, and it's just like, this is my hair. It's, you know, it's thick. It feels, it's real hair.
Hey everybody, I'm Dean Banowitz, Hollywood hair guy, celebrity stylist. Everybody asks how they can look younger. And when you have a fuller, thicker head of hair, you're gonna look a lot younger. Well, people always think I do have the most amazing hair. They don't realize that I actually have had a Bosley restoration. Since I've had my restoration done, I've probably sent close to 50 people to Bosley. Not only because it's amazing and it works, but they guarantee it. And the key is it's prevention, retention, and restoration. Now, I have a full head of hair, beautiful, shiny hair that I can color, I can cut, and I can style it any way. I can do all of that, whatever I want, because now I have hair.
Bosley gave me my hair back. I can pull on my hair, I can do whatever I want with my hair, I can mess my hair up.
I battled hair loss for about 20 years until I decided to finally get the procedure done. And thanks to Bosley, now I have hair. I have hair where I did not have hair.
When I first started noticing I was losing my hair, I was about 28. One of the first triathlons I ever did. All I was thinking about was pulling off my swim cap and how bad my hair was gonna look. I look back and I didn't realize how much it affected me until after I got it done. If I have any regrets, it's that I didn't call Bosley sooner.
So here's my before photo. I got a good widow's peak going on, a good horseshoe pattern. I don't even recognize this guy. Now after Bosley hair restoration, I have a great head of hair, and I could not even be happier.
We combine all the medical development, the scientific development, and translate that into an artistic outcome. You want it to be artistically wonderful. You want it to look like a great head of hair, and that's what we pride ourselves in at Bosley.
We're out of time, but final message about why experience, the Bosley experience, that means that you've done so many, really matters if you're going to get this done. And also, what do you say to the person that they really don't like their hairline, but for whatever reason, and they have the money, whatever, but they're just not doing it. They're not taking action. So if you could address both of those things before we close
Experience matters in everything, and in hair, it especially matters. We're obsessed with hair, we're experienced with hair. You want to look right when you're done.
Okay.
This is not something you want to redo, and we can do that.
And those people, by the way, that are putting this off, like you said, many people hate their hairline for many, many, many years, and then they finally come in.
Missed opportunity, missed opportunity. I always hear about opportunity cost. You're putting off something that you'll be really surprised how much can be done to get you the benefit you want, and you know you want it.
Okay, so get the packet.
Get the
your
packet,
information packet, the
and
book.
come in and see us in consultation. Get as much information as you can. I think you'll be really pleasantly surprised at just how good your hair can look.
All right, good. I want to thank you for coming on the show. Great stuff.
Thanks.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.